This is a muscular anatomy review of the hip, focusing on the adductor group. The adductors of the hip include the adductor magnus, the adductor longus, the adductor brevis, the pectineus, and the gracilis. If we dissect away the other musculature, we will come to our large adductor group. Beginning with the largest, the adductor magnus, we remove some of our other adductors so we can see it more easily. The adductor magnus, as its name implies, is the largest of the adductor muscles, originating from the inferior ramus of the pubis, as well as the ramus of the ischium and the ischial tuberosity posteriorly, and inserting onto the inferior portion of the linea aspera and the medial supracondylar line, as well as you see here, part of the adductor tubercle. Because of the varying insertion points, we classify parts of the adductor magnus as either being the adductor part or the hamstring part, as the adductor magnus not only performs hip adduction, but it also helps in hip extension. If we remove the adductor magnus, we will see the other muscles within this group. First, the adductor longus, which has an origin on the body of the pubis and inserts onto the middle third of the linea aspera on the posterior aspect of the femur, seen here. And as a member of the adductor group, its primary function is to adduct the hip. As with the other various members of the adductor group, the adductor longus is innervated by the obturator nerve and receives blood supply from the femoral artery and the obturator artery. If we remove the adductor longus, just superior to it is the shorter adductor brevis muscle, which has an origin on the body and inferior ramus of the pubis and inserts on the superior portion of the linea aspera. The pectineus, as previously mentioned, in the hip flexor group, has an origin on the superior ramus of the pubis and inserts on the pectineal line of the femur, just inferior to the lesser trochanter. This muscle assists in hip flexion as well as adduction. Lastly, within the adductor group, we will talk about the gracilis muscle, seen here. The gracilis muscle originates on the body and inferior ramus of the pubis and inserts on the superior aspect of the medial surface of the tibia, which is also known as the pes anserine. Along with the sartorius and the semitendinosus, the gracilis makes up the se grace before T group that inserts in the pes anserine. Along with hip adduction, the gracilis assists with internal rotation of the hip and knee flexion.